Hello and welcome to One People with Rakshita. I am so excited for this episode because with this episode, we are literally moving towards health. We will be talking about things which pertain to your internal as well as external health. That means we will be talking about your lifestyle and how by taking medicines as well as by working on your emotions, you can improve your health in 360 degrees. Please join me in welcoming Dr. Akshat Chadha. He has over a decade of experience in the field of medicine with an MBBS and MBA in healthcare management with expertise in lifestyle medicine. His work puts special emphasis on diabetes, thyroid, PCOS, and obesity. A strong believer in mind-body connect, his treatment methodology includes training his patients' minds while treating them for physical ailments. Hi, Dr. Akshat. Thank you so much for coming on board with One People. I am so excited to discuss everything there is to know about health, to know about lifestyle, to know about integrative health, and how actually a one stream of medicine you're combining to establish a mind-body connect. Before I start, I would just like you to tell me a little bit about yourself, your journey, and what is lifestyle integrative medicine.
Okay, so like you said, I'm a doctor. So I've done my MBBS. So I actually come from a long line of doctors. My parents are doctors. My grandfather was a scientist. My masis, my uncles. I mean, literally all the specialities are there in my house, within my house. By default, I had to choose between either being an engineer or being a doctor.
Okay.
I went for engineering classes, but I literally ran away, midway only. So by default, I had to go, become a doctor. So fortunately, got into MBBS, finished my MBBS. But I always had this fear that I should not do something wrong with a patient, especially when a critical case comes in. So we have a lot of emergency cases, critical cases, ICU cases. So it was a constant fear in my, was I good enough to actually treat this, emergency case? So because of that fear, I shifted towards management. I went and did my healthcare management, an MBA in healthcare management, was a full 2-year course. After that, I worked with one of the Mumbai hospitals, Hinduja Hospital, for about a year, but in the management section. Okay. But even in that management section, I was, still meeting patients. When I started coming back to clinical work, I started working with my dad as a junior doctor. So junior doctor का सबसे बड़ा role क्या होता है? They have to take history. What is history? What do you do? What do you eat? How much exercise you do? When did the disease start? All of that, chief complaints, करके family में किसको बीमारी है? All that is history, and that is responsibility of the junior doctor. Okay. So within that history, I started deep diving more into क्या खाते हो, क्यों खाते हो, कितना पानी पीते हो, and that time the word lifestyle was really not in our vocabulary. We didn't know what I didn't know what I was doing. I was just asking a bunch of questions and started making changes within that questions. Okay. And what happened is then when they used to come for a follow-up, and if they've done, what changes I have said, then the numbers like sugar kam ho gaya, thyroid levels better ho gaye, vajan kam ho gaya. Because of that, my dad was able to reduce medications. Acha. Then we realized that there is something which is, missing. Everybody's living longer. I think living longer is not the problem. Quantity is not the problem. But even while you're living longer, the quality of your life is not as good as you would expect it to be. Right. So even a 40-year-old today will complain that I'm so tired, मेरे को अपने बच्चे को उठाने नहीं होता है. I mean, by the end of the day, also there are times where I don't want to look at my kid. I don't want to play. So even small things like this reduces the quality of life. Right. So then when I started working, I realized that this is an aspect which is very important. And when you fix it with your lifestyle, now you ask me, what is lifestyle medicine? Yes. Lifestyle is what you do every day. What are your habits? So we have a bunch of habits which form your routine. And when that routine is over and over, repeated, that is your lifestyle. So what you do every day defines your lifestyle. Okay. So it's not only what you eat, but how much you eat, why you eat, how much water you drink, what are your sleep patterns, what time are you sleeping, how much stress do you take, are you an overthinker, do you bite your nails, do you brush your teeth? These are all bunch of habits which are strung together, and this is your lifestyle. Right. So a medicine, the study of lifestyle becomes lifestyle medicine. And to put it out there, of course, it's not a mainstream degree. It's not a mainstream degree yet.
Yeah.
But there are a lot of societies, there are a lot of doctors who are working, myself included, to actually make it a part of either the MBBS curriculum or make it a specialization after MBBS also.
Okay.
So of course, it's work in progress, but I hope it becomes a mainstream field very soon.
So, when you talk about lifestyle medicine, to what extent is healthcare or medical practitioners utilizing it currently? Because as to what I see a very small bunch, probably people on social media, as to what my exposure it is, talking about lifestyle medicine. But based on your experience and your interactions in your community, to what extent is lifestyle medicine there is and increasing?
So it's increasing. I wouldn't say it's a huge bunch, but I think there are a lot of coaches, there are a lot of nutritionists also who do practice lifestyle.
Yes.
Maybe not lifestyle medicine per se, because medicine kind of becomes a little bit more maybe technical also, maybe where you're talking about. So you have to understand that when I'm saying lifestyle medicine, as a doctor, as a lifestyle doctor, I'm a bridge. I'm looking at your lifestyle and I'm looking at your medications.
Right.
So I can actually choose between what is the best, the best of both worlds for my patient, basically. Right. So that bridge, obviously that bridge is very few doctors are lifestyle practitioners. But if you say, does a doctor or does a nutritionist use lifestyle in their practice? Yes. Because even now, if you go to any doctor also, आप endocrinologist बोल लो, आप orthopedic बोल लो, nowadays they've started using words like, are you doing a walk? आप क्या एक्सरसाइज करते हो? एटलीस्ट 30 मिनट्स आपको वॉक करनी है. आप सब्जियां खा रहे हो कि नहीं, फाइबर खा रहे हो कि नहीं, आप पानी कितना पीते हो. Now this was not a conversation very typical a conventional doctor would have.
Yes.
But now, including my own doctor, my own dad, who's an endocrinologist, he's having these conversations with his patients.
Correct.
So ask me if it is building up. It's definitely building up. It's going to blow up very soon because the results are there, right? Patients are feeling better. Medications are going down. So if these changes are happening, I think everybody is going to adopt it very soon.
So how do you go about establishing that mind-body connect? You spoke about habits. You spoke about changing the lifestyle. So shed a little bit of light on as to how one can go about achieving that holistic, wholesome life. Like currently, I might be in a certain situation. I do not have any problems, picking up the child and all of that. But of course, as the age number advances, those issues are bound to come in. So how does one sustain and maintain their current lifestyle, their current health?
So people always talk about motivation. People always say, I'm not motivated to, exercise. I'm not motivated to eat right. So I always tell them that you keep motivation to one side. Okay. You should actually look at discipline. How is your day carved out should be done under discipline. If you are disciplined, and now let's not think that discipline means strict. मतलब मैं कुछ भी नहीं खा सकता. I cannot touch even a mithai. I mean, I can't have mangoes. There are so many things which are going on as a myth actually. So that I'm talking about discipline. You define your discipline. You define your practicality. You define what is easy for you, what is fun for you, because you need sustainability. Now, when you say mind body connect, or when you say that I don't, so there are, let's say, two things first. Let's say, मेरे को कोई problem नहीं है. I'm actually okay. I don't have any chronic disorder. I don't have diabetes. Like you said, I don't have a problem with my energy levels. I don't have a problem. Then why should I have a good lifestyle? Because like you said, Kate, you're trying to prevent something. Suppose you have family history of diabetes, for example. I know now, both my parents donor side grandparents have diabetes. So far, my parents are okay, but it is there. So my aim is that probably I will either prevent diabetes for me, or I will postpone it कि यार के 40 में नहीं होना चाहिए, 50 में नहीं होना चाहिए. अगर होना है तो 70, 90 में हो गया तो, if I'm of course living till then, but at least when I trigger the diabetes is what is important. So lifestyle obviously fits in over there also, right? If you say कि मेरा पेट का मोटापा बढ़ता जा रहा है, then that's a sign. That's a sign that there's a chance that you can become diabetic. You can go into insulin resistance. You can go into fatty liver. Your triglycerides can start increasing. So these are all small indicators. Then there's a lot of indicators when you talk about muscle loss. कि वजन तो ठीक है, but कंधे वगैरह, especially this is more common after the age of 50, 60. कंधे वगैरह पतले हो रहे हैं, पैर पतले हो रहे हैं, पेट का मोटापा is not reducing. So these are all small indicators that we have to look at to understand whether what are we doing for the next 10 years, basically. So thoda, it's more about planning a little bit for the future also. And where the mind body connect comes into all this is to help you to keep going. So like you say, okay, this is something which controls your entire body. यहाँ पे अगर ठीक नहीं लगता है कि suppose you said I'm stressed today or I'm in a situation of chronic stress. Now chronic stress means something जो लंबा चल रहा है, जैसे broken marriages are there, legal issues are there, someone is unwell for a longer period of time, which is chronic. Of course, nowadays the problem is छोटी छोटी चीजों को भी we blow it out of proportion and we make it sound like it is chronic. But there are genuine chronic issues which can put you into ill health, into sickness. So these are the situations where the mind-body connect even become more important because it's a two-way street.
Right.
If you feel better physically, you can pump up the mind a little bit. But there are a lot of times where you will not feel physically fit, but your mind can help you pump yourself. Like simple cheez hai, I have decided to go for a walk in the morning. Right. Or I have decided to get up at 7 a.m. in the morning. Even that requires the mind body to be connected and activated. Okay, there are a lot of reasons that we will not exercise. There are a lot of reasons where I will not get up in the morning to do basic stuff also. But of course, अभी जैसे अगर हमको छुट्टी पे जाना है या पिकनिक पे जाना है, कोई बात नहीं ना, हम तो 4 बजे सुबह भी उठ के चले जाएंगे. Now, why does that happen? Obviously, because we are looking forward to something. It's very easy to activate the mind and say कि ये तो अच्छी चीज कर रहे हैं. So उठना, it becomes easy. So that mind-body connect is something which needs to, you need to harness the power of that every day. That's the whole point.
So you spoke about people are suffering from chronic stress, and more people are suffering from it. In fact, there is a census that even the younger generation, younger kids and young adults are suffering from chronic stress, and their mental health is not as good as it should be. So how do you help such people? How do you go about, apart from, of course, giving them medication, what is the process that you follow?
No, so I have a very different way of looking at mental health and stress. Actually, not mental health, but I have a little perspective of stress. I like to look at stress very differently. Now, when you say young adults also, okay, there are genuine young adults which need help from a mental health perspective.
Yes.
Okay. And there are genuine young adults who make stress for themselves. Now, people might say, no, I'm not making stress, but people do it. People overthink, kal shayad kuch hoga. Or even things like you hear about even a simple heart attack where people have passed, celebrities have passed and all, they absorb it too much that this is going to happen with me. Then all the actions are driven by the fear. There are a lot of times where we make stress for ourselves also.
Right.
Okay, some small, okay, simple. Aaj aapki maid has not come. Your maid has not come today. Simple. Even my house, I have seen my mom or my wife, or sometimes I used to, but now I'm okay. But there used to be a panic button कि क्या होगा.
Right.
उसने मेरे को inform नहीं किया, she's not coming today. At least बता देती थी, and there's a lot of series of actions which happen.
Right.
But I always encourage people that whether it's a small thing or whether it's a big thing, just 2 minutes, just pause. Just pause for 2 minutes and say कि okay, maid नहीं आई है तो क्या होने वाला? अच्छा, क्या खाना नहीं बनने वाला? या आज घर की सफाई नहीं होगी. ओके, तो अगर 24 घंटे अगर सफाई नहीं हो और अगर खाना नहीं बना, so क्या होगा? What is the worst thing that can happen? So a lot of times when you break it down for yourself, the mind relaxes.
Right.
Once the mind relaxes, then there are ways to open it up and say कि हाँ हम ये भी कर सकते हैं. चलो, today we will just make khichdi. Right. Okay, we will just have a salad along with the khichdi and it's a wholesome meal. It's done.
Right.
I don't need a 5-course meal. So when we just stop, when we just pause for a minute, then the ideas will also start flowing. Once you have the idea, once you stop feeling helpless, then automatically you feel less stressed.
Right.
If you feel less stressed, then obviously you're in better health. No?
Definitely.
So the idea is don't run behind a stress-free life. You'll run behind how to handle that stress and perceive that stress, because that is the solution.
And that's where the mindfulness also comes into play. Just pause, take notice of your breath, and realize that, what worst, as you said, what worst that can happen. Kya ho jayega? Perfect. Are there any tools that people can utilize to assist them to be more mindful, to be more present, to pause, when they are in the process of overthinking or just about to get overstressed?
Correct. So basically, the first most important thing is that we have to have mind space. Okay, agar you're a multitasker, you're doing 3 things at a time, or there have things which are happened in the past. Past mein kuch hua hai, and you're still holding on to that, which majority of us have had something in the past, some baggage that we are still carrying.
Right.
So the first tool is to create mind space. How do you create mind space? One is jo past mein hua hai, you have to accept it, you have to handle it, accept it, and then you have to try to let go. I know when I say let go, people say it's not easy, sir. It's not easy. And I agree. I have also been through a lot, which it took me many years to let go, but theek hai, it happened because I think the intention was there that I have to move forward.
Right.
Aage we have to do, I have to kind of, accept this and move forward, not press it down, not suppress it and then move forward.
No.
So I think that is very important. So things like expression, अभी आप उसको journaling बोल लो, आप उसको counseling बोल लो, आप उसको talk to somebody. Now, of course, when you're talking to somebody, there is an expectation कि कोई मेरे को solution देगा. So that can sometimes backfire. So it depends. But journaling is a very strong tool that I personally have used and I believe in. Then meditation, again, the only thing is meditation is looking inwards.
Right.
तो जब अंदर ही इतना भरा हुआ होता है, so meditation can sometimes become very overpowering, overwhelming. You need to understand when to use meditation also. Breathing is, I think you mentioned in the beginning only, your breath work is something which is very important. The minute you get anxious, palpitations हो रहे हैं, समझ नहीं आ रहा है, if you just breathe, half the thing, मतलब होती है ना, घोड़े की लगाम होती है ना, तो आपकी जो breath है, वो आपकी mind की लगाम.
Absolutely.
Okay. And there are positive affirmations, there's visualizations, all these are tools. But my strong suggestion to everybody is don't try to do everything.
Yeah.
If you try to do all the tools, you will get further overwhelmed and then you're like, nothing works.
Yeah.
ये तो इसमें सही नहीं. So you have to understand, you have to pick and choose आपको क्या अच्छा लगता है. Someone might just say, I like to pray.
Right.
Pray outward. ठीक है, pray कर लो, कोई बात.
I used to be one hell of an overthinker because invariably by nature I am highly competitive. So from every field, be it in family, be it in studies, education, career, I would always analyze and overanalyze everything. बाल की खाल निकालना मुझे बहुत अच्छे से आता था और उस चक्कर में I would stress myself out. So it's been around a year, and as you said, you cannot do everything, but you have to choose कि आपके लिए क्या चीज apt है. So I first started with workout. I used to love dance when I was a kid. Of course, when life happened, career happened, marriage happened, and कई बार you forget as to what you used to enjoy. So I picked up dancing first, and after that I incorporated meditation. And you literally, hit a bullseye when you said that meditation can get overwhelming. So rather than going through the very intensive path, I simply do a gratitude sort of a practice. For 10-15 minutes, I count my blessings from the past day and from the present day in terms of my being, my breath, my health, my lungs, kidneys. Be grateful for all of that. And then I follow it up by setting an intention for the day. And that way, my day is not only productive, I am so stress-free. I'm so relieved that there is no backlog or no, chatter happening in my head.
Exactly. तो आप तो 10-15 minutes gratitude बोल रहे हो. I am तो saying अगर आप 2 minute भी gratitude बोलो कि मेरे what are the 2 things that are good in my life or in my day.
Yes.
और 3 things आज अच्छा मेरे साथ क्या हुआ.
Yes.
Automatic reset the mindset वाला situation. You will really see the world in a different space.
और 2 चीजों से अगर आप शुरू करोगे 2 मिनट का, तो वो धीरे धीरे नेक्स्ट डे आपके पास 2 चीजें और होंगी
और आ जाएंगी.
ऑटोमेटिकली जब आप पॉजिटिव सोचोगे, वो पॉजिटिव चीजें नोटिस करना बढ़ जाएगा. सो अभी आज एक चीज के लिए थैंकफुल हो, कल आपको ऑटोमेटिकली 2 मिलेंगी, अगले दिन 3 मिलेंगी, और वो जो 2 मिनट की ग्रेटिट्यूड प्रैक्टिस थी will increase to probably 5, 10, 15 and half an hour as well.
Absolutely.
Great. So my next question is, Dr. Akshat, there are a lot of people who genuinely have time crunch, and I have seen it in my real life. They have very tight schedules. They travel for 1.5 hours for job. Then they do their whatever, corporate jobs. They come back late at night, 9, 9:30, 10. And then their family also expects time. The family
Absolutely.
also expects some sort of their presence in their lives. So what advice would you have for such people who leave early in the morning and they literally do not get time to spend it on themselves?
So see, this is a difficult situation, but I do agree. Many people are living these lives. Many
Yeah,
people. But the way I see it is everybody has 24 hours in the day.
right,
सबके पास 24 घंटे है. My thing would be, let me split it for them. So if I say 24 hours, what is an ideal way of living I will give you. And then each person has to look at themselves and find the space for that. Let me break it down. So 24 hours है आपके पास. Let's say आपने 7 hours, चलो ठीक है, 6 to 7 hours की sleep करनी है. Okay, so we say about, if I say 7 hours. अभी अगर आप 24 minus 7 करो तो कितने होते हैं? So I'm a doctor, so I'm supposed to be bad at maths. So Rakshita, tell
24
me.
minus 7 is 17.
17? Okay. तो 17 घंटे बाकी है.
Yes,
Okay. Suppose we say 17 hours में से you take out, I prefer at least थोड़ा 15-20 मिनट खाना, बैठ के खाना चाहिए. So you don't eat in a rush. Okay.
right,
But I'm not a frequent eater. So even if you give me lunch, breakfast, dinner, maybe थोड़ा evening snack, ज़्यादा से ज़्यादा बहुत हो गया.
right.
तो अगर आप 1 घंटा खाने के लिए निकालो, बनाने के लिए नहीं, खाने के लिए, तो
अच्छा,
आपके 1 घंटे और कम हो गए, आपके पास 16 घंटे बाकी है. अगर आप 16 घंटे में से सपोज वी से, चलो फॉर आइडियल पर्पस वील से 1 घंटा एक्सरसाइज के लिए निकालो, आइडियल पर्पस. ओके, 16 घंटे -1 15 घंटे हो गए. ओके, अब 15 घंटे में से यू आर सेइंग लेट्स से 8 hours वर्क एंड अनदर 2-3 hours ट्रैवल वगैरह पकड़े. हाँ, तो 10 घंटे और निकाल दे. सो 15 minus 10 यू स्टिल हैव 5 hours. अब ये 5 hours में 1 घंटा चाहिए, तो अब ग्रूमिंग, वॉशरूम, बेदिंग वगैरह एक और निकाल दीजिए. अभी आपके बचे 4 घंटे बाकी है. अब 4 घंटे में यू हैव टू डिसाइड, you need family time, you need me time, because all my basics that I want are there.
right,
You say that I will work out for half an hour and I will do a little bit of pranayam, 10 minutes, I will do 5 minutes meditation. Okay, because I've already taken one hour. So what I feel is that one thing that we have to do is we have to split the day for ourselves, split the 24 hours and say कि कहाँ जा रहा है time. Even when you say, people say, no, I don't work for 8 hours, I work for 10 hours, I work
yes.
for 12 hours.
That was my next
I
question.
tell them, you review it. Are you genuinely working? Can you become more efficient? Can you be a little bit more productive? Can you finish your work a little faster? Because I have been through it.
Yes,
I have gone from working for 12 hours unnecessarily. Why? Because this is a distraction. I'm trying to, exactly. So I'm trying to type something, notification aa gaya. Bhale, it's a work notification. I'm not saying I'm doing Instagram or anything. It's an email has come or a WhatsApp has come, some patient has messaged. But it's not something which requires me to urgently jump and leave this and jump. Now what happens is when I used to do that, जो मेरा chain of thought था वो टूट जाता था.
yeah,
I would take another 10-15 minutes to get that chain of thought back and then type what I was doing. So I started making a rule for myself कि phone तो मैं बंद नहीं कर सकता, okay, but मैं notification बंद कर सकता. I stop my notifications. मतलब 3 घंटे मेरे को कुछ काम करना है, I will stop the notification. या जो some people might say 3 घंटे बहुत लंबा होता है, 1 घंटा आप notification बंद करो, finish what you are doing and then look at the phone. That's a different thing. I picked up something more to do in the last 2 hours also, but that's a different problem. So that's the next problem.
That's us trying to stay busy.
Exactly. No नहीं बोल सकते. Either we want to be over productive, कि अगर ऐसे कुछ काम के बिना रह गए तो ऐसे गिल्टी लगता है कि यार हम काम नहीं कर रहे. या तो दूसरा होता है कि someone is coming to us and we can't say no. हमको no बोलना नहीं आता. या of course, even when it comes to you have lots of work coming in, पैसे को मना नहीं कर सकते. So that's again, see, that's another choice, right?
Yes.
So if you say no, doc, I have to pay for, my EMIs have to be paid. I need more money, so I get it. So I'm not denying, I'm not saying that money is not the right thing, but where do you balance your health? Where does that work-health balance come, work-life balance come, health-life balance come, is your decision at the end of the day.
Absolutely. Setting your priority list is in your own hands. I'm a photographer, as a profession. I am a photographer, baby, maternity, and family photographer. And on the days, I would do three, four shoots in a day. Because of course it's good money. I like to create stuff. But after a point in time, I realized what I was compromising in the process of making that money. And that money, no matter what it's worth, it's costing me far beyond when it is affecting my health, because my back started hurting, my knees. I mean, I'm not even 40. My knees started to hurt, and that was such a shocker. I was like, I can't be doing this, I can't be living like this, and I can't be working like this. Because if my body gives up, then what's the use of all this money, or what's the use of all this work that I'm doing?
So there are a lot of irreversible conditions that money can't reverse. We have to understand this, that there are a lot of irreversible conditions that money can't reverse. That is one. Second is, you have to understand, जो suffering होती है, जो sickness की वजह से, ill health की वजह से, एक तो हमको होती है, और जो हमारे family को होती है, जो हमारे care givers को होती है, क्या करोगे उतने पैसे के साथ? ठीक है, you will say that if I have more money, I can appoint people to take care of me. But the pain that you are going through, they can't reduce that pain. Right? So I'm not saying that I can reduce every person's suffering. I'm not saying that, but I'm saying that you have a chance to either prevent it, postpone it, reduce it, whatever it is. But it starts today. You cannot say कि मैं, till the age of 50 or 30 or 20, whatever you say, I will, really overkill myself. I love my work. I will be a workaholic. I will do everything. And then later I will retire and take care of myself. It doesn't happen like that, because life is going on and on and on. There is no stopping. Time is going on and on. There is no stopping. That's the whole problem.
Days pass, weeks pass, years pass, and you realize that, oh my God, we just spent all of it working. We didn't even take our time to enjoy the money that we were earning. Many a times, there have been many cases, my family itself, like my father, my Tauji, everybody used to work intensively, and they didn't even get a chance to enjoy their money. And that is like the biggest irony in life.
That's just the way it is. These are all choices that we make. So I'm not saying don't have aspirations. Please have aspirations. If you want to go to the US, please go ahead. No problem. But not so much that, it's affecting your health in the longest run.
Right.
So like you said, it's the exact correct word is priority.
Another problem I see people have is they do not even have their priorities right. They want everything all together. It's like a cluster of, wishes and desires. Those are not needs. Nobody can call them needs, but they want everything all in one go. And
yeah, so that's a little bit of greed also that is there, right?
Greed. Absolutely.
Yeah. So how greedy you want to be, again, it depends. But somewhere the balance will break. Somewhere you will lose out on something.
True.
My parents always tell me, you have to choose your time very, very properly. कि आप time कहाँ डाल रहे हो? Because जब आप किसी चीज को time दे रहे हो, तो किसी और चीज को time नहीं दे रहे हो. So you have to understand, okay, you might be multitasking, but you have to choose your time very, very correctly.
Right. So what, according to you, Dr. Akshat, are the three prerequisites for people in different stages of life that they should incorporate in their life in order to have a wholesome life?
Lifestyle has 6 pillars. So we have to build on the 6 pillars. You cannot build on all the 6 pillars every day. So it's more of a balance. But basic stuff is obviously your nutrition is important. But it's not protein. It's not only protein requirements. It is your protein, your fats, your carbohydrates, your fiber. In fact, I encourage people to eat more fiber. Fiber is more of vegetables. Fruits, okay, maybe 1 or 2, of course you have to have, but don't overshoot the fruits just because Akshat said fiber khana hai. But vegetables in the cooked form, salads, saute vegetables, every meal ke saath thoda khao. It makes a huge difference. All the chronic conditions that we spoke about, including fatty liver, if you have more fiber, it's easier to handle it or even prevent it or manage it or reverse it, whatever you want to call it.
You talk about fiber. Is fiber good for most of the conditions that you treat, including diabetes, PCOS, thyroid, any other ailment that it is useful for?
Everything. Heart disease, cholesterol, hypertension, everything. Okay. You need fiber for everything. The only choice is sometimes which fiber to take. And some people with gut issues find it a little harder to digest raw fiber. Kakri tomato, raw form mein, they might find it a little harder to digest. But otherwise, it's quite universal and quite generic that you should take fiber with your meals. So that is important.
Okay. So that's the first pillar of nutrition. What are the others?
So along with nutrition, we have to talk about hydration at the same time. हमने बहुत सब कर लिया, exercise कर ली, but हम 1 लीटर पानी पीते हैं. So whatever you want to achieve, your dehydrated body will not be able to achieve that. Second is, now the other problem is, again, we are a world of extremes, right? Human beings को अगर कुछ बोलो कि बहुत अच्छा होता है, अभी वो vitamin D बोलो या पानी बोलो, they will overdo it. So
yeah.
hydration, especially over 3 liters, 3.5, 4 liters, 5 liters,
Yeah.
is a genuine problem.
Is a problem.
Problem. Yes.
Oh, so but there are a lot of like studies and everything say have so many liters of water, gulp down, drink. Have you had enough water in a day and all of that?
So I don't know about studies and research, but I'm very clear. Your balance is between 2 to 3 liters of water, unless you're going for a marathon or you're an extreme athlete or something, then you add that extra liter, no problem. That's different. But as a general lay person, even Akshat will limit himself between 2 to 3. In fact, मैं तो 2.5 से ज़्यादा पी भी नहीं पाता हूँ मैं. So my limit is more of a 2.5 liters. And you mentioned the word gulping. You should really try not to gulp water. Take sips for water. Of course, now I'm not saying that every time वो छोटे-छोटे sip लेने. That's not what I'm saying also. But people will take one glass, 200, 200, 250 ml of water they'll take, and they'll literally take it like a bottoms up, you know. So try not to do that. You have to have more water through the first half of the day, spread it across. And then, of course, post dinner and all, don't have too much water, because then the chances of urination in the night also increases.
Right.
So be very careful. I know for a fact that working people also, they will not drink water 4 बज गए 5 करके 2 glass पानी पिया, and then they try to compensate in the second half of the day, you know. So please don't do such things at all. नहीं पिया ठीक है, then try again the next day, but first half has to have the chunk of the water. We have to be very careful about that. So that's your first pill. Second is now exercise. Now, जैसे आप ब्रश कर रहे हो, सुबह उठ के ब्रश कर रहे हो, simple exercise has to become a part of you. Now, whether it is a 20-minute walk, whether it is 30-minute gym, whether it is 40 minutes Zumba, you decide. I don't have a problem, but give me at least 30 minutes of some form of exercise, at least 5 days in a week. At least वो थोड़ा minimum तो you should give me. Along with that, you have to have more movement through the day. सिर्फ बैठे 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 नहीं रहना है. Just start moving a little bit. Now, I'm again not saying 10,000 steps. 10,000 is a target you can achieve eventually. Okay. But if you are at 2,000, then go to 3, 3, 4, 4, 5, 6. Don't try to jump from 2 to 10,000, because that is how you will injure yourself.
Okay.
So exercise along with movement, reduce sitting time, वगैरह. Of course, over exercising is also a problem. So anybody who's over exercising means, let's say, over 2 hours, so you are headed for different kind of trouble, injuries, poor recovery. So you have to be careful about that also. Okay. Then the third pillar is your sleep. Most underestimated drug. आपको ठीक होना है, रेस्ट करना है, रिकवरी अच्छी करनी है, you want to be more productive, you want to be more efficient, you want to reduce brain fog, you want to manage your being anxious, go to sleep. And please try to set your rhythm at night. जो आपकी रात की स्लीप होती है उसको ठीक करो. If you don't sleep, now very clear example, अगर रोड पे काम चल रहा है, they are trying to make the road or dug it or whatever, potholes को ठीक कर रहे हो, अगर रात को अगर सुबह सुबह करो जब your more cars are there, obviously काम नहीं होएगा. So they choose to do it in the night where the cars are minimum. Why? Because it gets time to get settled, it gets rest. So that same time, if you want to recover, you want to thrive, you also have to take rest, and that is your night sleep. You want to recover, you want to repair. It has to be done when you're sleeping at night. So अगर आपकी रात की स्लीप ठीक नहीं है, आप 2 बजे सो रहे हो, 5 बजे उठ जाते हो, या 2 बजे सो रहे हो और 10 बजे भी उठते हो, 8 घंटे तो हो गए, which is okay. But why are you sleeping at 2 o'clock? Because I'm scrolling? That's not right. Why are you sleeping at 2 o'clock? Because sometimes I have to work. Okay, ठीक है. So again, you have to pick and choose, but one is quality of sleep and second is the quantity of sleep. So दोनों को आपको maintain करना है. Okay. Then fourth pillar is one of the most important pillars.
Before we move on to fourth pillar, Dr. Akshat, how good or beneficial is afternoon sleep or afternoon nap?
So I encourage afternoon nap for about 30-40 minutes, 45 minutes tops, especially for people who get up very early. 5 बजे उठ जाते हैं, 4 बजे उठ जाते हैं, 6 बजे भी उठ जाते हैं. So what happens is their day gets quite extended.
Right.
So even if you take like an afternoon nap or a mid-morning nap also. So like a lot of women I encourage ke breakfast kha liya. And they will tell you also that one part of the work is done. I've had breakfast and I feel this slump. And
Yeah.
I tell them, if you had a nice wholesome breakfast, कि ये नहीं कि सिर्फ आपने सिर्फ प्रोटीन खा लिया या सिर्फ कार्ब्स खा लिया, but if you eating properly, balance करके खा रहे हो, then you might not feel the slump if it is food related. But if you still feel the slump, that could be because you're physically tired also. So even if you like catch a nap probably an hour after breakfast, half an hour after breakfast, just थोड़ा सो गए, late भी गए, so you will feel refreshed. People say, no, I'm very scared. You are scared because you will overdo it. अगर 2, 3, 4 घंटे अगर आप सो गए दोपहर को, फिर आपकी रात की नींद खराब हुई.
Yeah.
Very, very likely. So you have to kind of understand that no, I have nothing against an afternoon break at all.
Wonderful. Sorry, we were going on the fourth pillar now.
Fourth pillar. The fourth pillar is the mind. Your stress levels, your mental health, sab isme aata hai, you know. And I think that is something that we've already spoken about, so I don't want to talk about it again. But if you harness the power of the mind, then you can really achieve a lot of it. But now again, we are going in a world of over-analysis, overthinking, कि यहाँ क्या चल रहा है. So now you're stressed about being stressed. That is another big problem. So my sincere request is कि not over-analyze stress. हाँ, stress है, उसको handle करो और आगे बढ़ो. उसको अगर आप पकड़ के रखोगे, इसके वजह से मेरे को ये हो गया, इसकी वजह से मैं बीमार पड़ गया, इसकी वजह से मेरे को डायबिटीज हो गई, हाँ हो गई, but you can handle it. So once you move ahead from that, then it becomes easier. So the mind body connect becomes your fourth pillar technically. Then your fifth pillar is addictions. Now addictions very typically are smoking, alcohol, drug abuse, substance abuse, all of that. And of course, I have to mention this every time I talk about smoking. Vaping is a form of smoking. Hookah is a form of smoking. Everything is detrimental to health.
Yes.
So if anybody has shifted to vaping, thinking that it is healthier option than smoking a cigarette, please stop that. Because in fact, that could be more harmful and more habit forming also. Why? Because the mind is very convinced that ये तो अच्छी बात है. It's okay.
And it's cool also, cooler than smoking.
And it's cool, yeah. I mean, I think smoking ka sabse bada problem is, of course, even the movies will show, the actor coming, okay, आजकल वो नीचे आ जाता है, smoking is injurious to health, but वो कौन पढ़ता है? I mean, come on, yeah. I mean, you have that cigarette box which has the most, ugliest and scary photo over there, but people will pick it up, and maybe turn it around, but it's still there and you can see it. But I think that's again, a choice at the end of the day. People choose to smoke purposely, and I don't know how to help them. I feel really bad for such people, but of course, समझा तो देता हूँ, but at the end of the day, it is your choice how you want to handle it. So these are the obvious addictions, but now we have not so obvious addictions. One is obviously tea. If I don't have tea first thing in the morning, मेरे को energy नहीं आती है, मेरे से काम नहीं होता है, और अगर शाम को मैं नहीं पीऊँ तो मेरे को headache हो जाएगा, So these are again form of addictions. Tea, coffee is an addiction. All your energy drinks is an addiction. Scrolling, I think now scrolling is the biggest addiction which we have to kind of deal with. I encourage a lot of people कि at least हफ्ते में एक बार, अगर एक दिन नहीं तो at least 3 घंटा apart from the sleeping time, lock away your phone. I challenge people 3 घंटा in the middle of the day, lock away your phone, even if it's a Sunday.
Yeah.
You say, मेरे को काम होता है, ठीक है? Sunday, if you're taking it slow, keep the phone away. I will guarantee you, you will be jittery. कि मेरा क्या हो रहा है?
You feel that you're not being productive because your phone gives you a false idea that you're busy doing something. Like I remember when we were younger, when we were in college, my mom always like, you guys think that we are fools. We don't understand when you're constantly on the phone and device and on internet saying we are working, but you can't be working 24/7. So, my eyesight got affected, and the same happens with a lot of my friends as well. But how now I have controlled it is what I do is I try to cluster my work. I cluster the similar tasks, be it emails, be it editing of the videos, or be it editing of the pictures, whatever it is, I cluster them together so that I tend to them in one go. And when I'm doing that, my phone is away. An hour, 2 hours, 3 hours, till the point in time that cluster of the job, that work is not finished, I will not touch my phone. So that doesn't only help me be more productive. My work gets finished on time. My work, in fact, the results are far more better. The results are improved. And then I get
And
to the phone and I
you
feel
will be
so
much
relaxed.
more creative also. Your creativity will
Also,
go up
because your
so
energies
much
are all
because
focused. Yeah. So I think there is a big illusion, the screen time does to a brain is that it gives you a false sense of being productive. Either you're scrolling through reels, oh, I'm looking at the motivational reels, oh, I'm looking at something, that
I
so and
want to
so
make
on
my
the,
own content.
yeah,
Nowadays, the
also
biggest thing is I want to make my own content, so I have to scroll.
get
So
inspired. Yeah, yeah, yeah. By the way, talking of
no,
content, your content is so interesting. I mean, it literally
no,
caught my
but
eye. You dance through your videos while spreading education about, health, medicine. How did that idea come about?
so I think it was actually, to be very honest, it was a challenge. I used to make. I was always a critique to a lot of health experts, not influencers so much. Because I mean, see, somewhere I feel that if you are following a influencer from a health perspective, that's your choice at the end of the day. But an health expert talking about not so right things online was something which bothered me. एंड आई थिंक व्हाट्सएप पे बहुत सारे आई थिंक कोविड टाइम इट वाज तो बहुत सारे मैसेजेस आते थे इम्यूनिटी बढ़ाओ ये
Mm.
खाओ ये स्नॉट करो ये करो सो and I was like y'all are health experts and a lot of my family members used to send that video to me कि यार देखो ये तुम what is this so my most of my replies never was okay go do it no it was always like what is this stop this don't spread this don't forward this message to anybody family group में भी आ गया then it was always a negative
Negative.
फ्रेंड्स के साथ भी ऐसा होता था सो देन वन डे माय फ्रेंड्स जस्ट सेड के if you have this much information and you're so confident why don't you come online and spread it
Yeah.
so my obviously was I don't have the time for this but somewhere it started whether it was the covid pressure or whether I was just irritated or whether I took up the challenge I don't know but it started but it was never planned dancing was never a plan at all it was literally
Honestly, you are the very first health practitioner. When you sent me your bio and it mentioned MBBS and all your qualification, I was like, this is different. This is so different from the regular norm, from anybody I have ever seen who's been so highly, in academics, a doctor, an MBBS. Yes, there are nutritionists. Yes, there are life coaches. Yes, they are doing various forms of content. But this was first for me. So very
so it was not a lot of my doctor colleagues used to message me and say, dude, what are you doing? No one is going to take you seriously. Patients are not going to take you seriously. Why do you do this? Both my parents are doctors, but fortunately, they never stopped me. Maybe because they're not really looking at every reel that I do. Maybe because of that also. But today I am kind of proud of my and say that I didn't follow a conventional route.
Yes.
And in fact, the dance actually keeps me healthy, keeps me
Yes.
physical active because there is some practice which is required. It's not that I can just go stand in front and I can just do my steps. No, I do follow a lot of trends or whatever is there, learn from the steps, and I do it. So it keeps me active. A lot of people do come and tell me that because I saw that reel, I have started making changes in me.
Right.
Now that is my whatever you say motivation, my reason for keep going.
Yes,
Keep
it
going
is
on.
one of the
Whatever.
biggest motivation I think you can have, because you are sending out a message that health can be super fun. Being super
Yes.
healthy, taking care of your health.
Yeah.
Health is not
Yeah.
a serious subject. I mean, everybody has talks about nutrition and wholesome health. Oh my God, it's such, something like I was speaking to a 20-year-old person and I showed them the podcast. Like, this is something my parents would watch. I was like, why not you? Like, oh, this is very serious. Where, people like you break that notion that health is fun. It helps.
And easy. I
Easy.
literally
Yes.
want to tell people that you can be healthy and make it easy. And if you don't make it easy, then you're not going to sustain it. If you don't sustain it, then you've just done a fad or a program or something, and that's it. So that's a big problem.
It's the same way,
Yeah, so
you're tricking your mind into doing something that you enjoy. Unless that thing is not easy, the mind is going to repel it.
exactly. नहीं होएगा वो आपने 3 महीना कर लिया 1 साल भी कर लिया बट अगर आपको मजा नहीं आया या इजी नहीं हुआ वो फिट नहीं हुआ then you will stop doing it. It will not become a habit. That's the whole point.
Very true.
Yeah. So this is like the 5th pillar is addictions basically.
Okay.
And the last pillar is more of medicines and monitoring. If you have a condition, you have diabetes, make sure you're taking your medicines on time, make sure you are, testing your sugars, make sure if your blood pressure, because a lot of people don't understand is that even if you want to get off medication, अगर आप कल मेरे पास आते हो कि मेरे को डायबिटीज मेडिसिन कम करनी है या बंद करनी है, I need to know what your sugars have been in the last 3-4 months.
Right.
I cannot reduce medication on one कि आज मेरा fasting इतना था, आज मेरा postprandial इतना था, अभी आप दवाई कम करो. It doesn't work like that. So even if you want to work on reducing medications, you have to monitor it. But there is one more thing in this pillar is deficiencies. Okay. A lot of people, 4 commonest deficiencies today I want to tell: vitamin D, vitamin B12, calcium, and iron. So mostly iron deficiency, anemia, especially in women, is one of the most common deficiencies. And it is so bad if it's chronic. अगर बहुत time से चल रहा है, then even things like palpitations, feeling anxious, feeling jittery, tiredness, hair fall, cravings of ice वगैरह, मिट्टी खाने का मन कर रहा है, ice खाने का मन कर रहा है, increases. So please, if you all are suffering from any of these deficiencies, mostly you will need a supplement for some time. And then उसके बाद whatever the nutrition side में आपको करना है वो करते रहिए. But अगर आपको सच्ची, if you have tested yourself, if there's a deficiency, whether you've gone to the doctor, if you've not gone to the doctor, please go. But I know people who will go to the doctor, they will give the medication, but they will not take it. Or they will take it, and जैसे iron से one of the commonest problem is constipation हो सकती है. Okay. So just because you have constipation, you will stop eating the iron? No. You can either treat the constipation, more fiber, more water, more movement, or you can change the type of iron also. So please go back if there's a problem with the medicine, but don't stop correcting the deficiency. You have to correct the deficiencies for sure. Yeah. So these are basically the 6 prerequisites which people must know about, and then imbibe it one by one.
Supplements. People take medicine as the and the ultimate resort to all of their health issues. Like you mentioned 5 pillars more, which comes before medicine. Rarely do people even analyze or recognize them in their daily lives. So thanks for sharing that. Another actually a very prevalent problem is gut issues. A lot of people have constipation, or the diet is not right, so they have a lot of acidity, heartburns. So in addition to all the 5 pillars and the 6th pillar that you mentioned, medicine and supplements, what other things or the foods one needs to have on regular basis to address that gut issue problem?
So gut issues, again, you have to split it. You say acidity, reflux and all, more of the upper GI. Then you talk about gas, bloating, constipation, more of the lower GI. Okay. Now what you have to understand is it's not only the food. Of course, if you say food wise, kya khana hai, obviously sabziyan khani hai. People going overdoing protein bars, protein shakes, protein powders can
That's
have
another
more of
fad. Protein is in such hype these days that it's insane.
Yes, and many, I think literally if I have to count on my fingers, it's about 8 out of 10 of my patients who come back and say that मेरे को bloating हो रही है, या gas बन रही है, या constipation हो रही है. If I ask them if they've suddenly increased their protein, suddenly, or they're taking 2 scoops, whatever, whey protein, plant protein, but they're mixing it in milk and also having, these are all sources of problem of gut issues. It's not easy to digest. So this is something that you need to be very careful about. I always tell people, try to understand what is it that causes it. कि कौन से खाने के बाद आपको problem हो रही है. A lot of times, people pass motions urgently. Motions after meals sometimes is okay, but urgently, I can't control it, could be a sign that something is not right. So even for such people, probiotics. Now, natural, you don't have to keep taking supplements for probiotics, but natural probiotics, simple, your dahi, buttermilk dahi is a very strong probiotic, homemade. बाहर से खरीद के नहीं लाना है. Homemade curd and dahi and buttermilk and all is a good probiotic. Even if you include 1 or 2 bowls a day, it helps you. Or there's something called as rice kanji. So 2 tablespoon rice को पानी में भिगो के रख के, keep it overnight, and then have the rice in the morning. That's also a probiotic for you.
Cooked
okay,
rice.
Then there's sauerkraut. Cooked rice, yes, cooked rice. Okay. जो भी दोपहर को या शाम को बनाया बच जाता है, उसको 2 tablespoon आप ऐसे preferably earthen pot में अगर करो, उसको पानी से भर के ढक के रख दो, you can have it in the morning. Okay. So that's also a type of probiotic. If you want more fancier than sauerkraut and kimchi and all are there, I think all the recipes are there online. You can look it up also. Yeah. But some amount of probiotic, prebiotic, जैसे अगर आप घर का अचार वगैरह भी खाओ, there's no problem. But it's a prebiotic. Of course, don't overdo achar at the end of the day. But these are all important prebiotics. All your fiber will become a prebiotic also. Okay, things like make sure you have garlic, you have ginger in your diet. Cook karo. You don't have to keep eating separately, but cooking may use karo and cook it nicely, you know. So these things actually help the gut. And water. You talk about people go for cleanses and detoxification and they are not drinking enough water. Have enough water. That will help your acidity and your constipation to a huge limit. Okay. देन आदत है पूरा दिन बैठे रहो, खाने के बाद बैठ जाओ, लेट जाओ, पेट पे सो जाओ, एवरीबडी विल हैव गट इश्यूज. टू मच ऑफ ऑयल, टू मच ऑफ सॉल्ट, टू मच ऑफ स्पाइसेस. अगर बहुत ज्यादा भी मिर्ची डालोगे तो यू कैन गेट बाउंड टू एसिडिटी स्पेसिफिकली ऑल्सो. ओके. देन टू हैबिट्स. वन इज हाउ यू स्टार्ट योर डे इन द मॉर्निंग. आप 5 बजे उठ गए हो बट यू आर ईटिंग, यू आर ड्रिंकिंग समथिंग एट 9 AM. 4 घंटे आपने कुछ भी खाया पिया नहीं है, bound to have problems. How you end your day in the night. Late dinners. आपको सोना 11 बजे है बट आप 10 बजे खा रहे हो. Late dinners. आपको सोना 9 बजे है बट आप 8 बजे खा रहे हो. Still late for you. So late dinners as compared to your sleeping time. So you have to keep 2 hours gap between sleep and your dinner and bedtime. 2 घंटे का गैप चाहिए कम से कम. Okay. And when you get up in the morning, simple glass of warm water पी लो, एक फ्रूट खा लो, नट्स एंड सीड्स खा लो. नाश्ता मत खाओ, चलेगा, but at least eat something light, something nice within an hour of waking up.
What you just listed is exactly how I wake up in the morning. I wake up at 5 and have dinner at 9 or 10. After everything, after the workout, yes, I do include like a glass of warm water with probably some wheatgrass or aloe vera juice and amla and all that. But as far as meal or eating something goes, it happens much later.
So just add 6 almonds you can have. You can add some pumpkin seeds, some, रात को soak करके just have it in the morning. Have 2 walnuts. Or I genuinely think if you have a fruit in the morning, so सुबह का जो fruit का time होता है, that's very good. You utilize the energy of the fruit also in your workout. So I personally love fruit as a pre-workout.
Okay.
And since you're working out in the morning, if you just do fruit and a little bit of nuts in the morning, that will give you better sustained energy. Your workout intensity will also improve.
Better.
Your recovery will be better. So pre-workout is again, which is very important, and late dinners and all. And I think one more habit which I should mention from a gut perspective is munching. अभी आपने खाना खाया, अभी 1 घंटे में कुछ और ढूंढ रहे हो खाने के लिए वगैरह, not good at all.
Right.
कम से कम 4 घंटे का you should have a gap between your meals, which means that you have to eat your main meals properly. कि ये नहीं कि थोड़ा सा खा लिया, सिर्फ सूप पी लिया, सिर्फ सैलेड खा लिया, ये सब मत करो. Don't do a restrictive diet, do a balanced diet, and then be full for about 3-4 hours. That is actually very productive and very good for the gut health. So it's called, we talk about IF, right? Intermittent fasting, dry fasting. This is called fasting between meals. That's the best part.
Fabulous. So what are the biggest myths, Dr. Akshat, which people these days, we mentioned about protein, you mentioned about, gut health as well. So what are the biggest myths that people are having these days that you would like to address?
One is, I think protein is a big myth. Now, when I say protein is not a myth, overdoing protein is a myth. And vegetarians not getting enough protein, that's also, so it's not a myth, it is difficult. The vegetarian might have to work a little harder to plan the protein out, but it doesn't mean that vegetarians ko enough protein ya nahi milta hai, so that is something that we need to be careful. I think just the fact that lifestyle is something where is very difficult. Lifestyle is something which is extra that we need to do is a big myth. And people think that, even if I have to lead, I think one of the biggest myths is that if I have to lead a good lifestyle or if I have to be healthy, it's very expensive. I think that's not true. Okay, no? I guarantee you, if you follow the free advice also that I give online, free advice, you will be absolutely healthy. Maximum that you need as a consult is for deficiency correction, or if you have a chronic disease, obviously then it's difficult. But even if you do one consult once a year, you can be healthy. Okay, you don't, every expensive thing is not healthy, and every not expensive thing is also not very unhealthy. So that's another thing, because people will go only for organic foods. And nowadays, poor organic food is becoming a fad where people are just putting thappas of organic food and it's becoming actually more expensive for the person to sustain that also.
Yeah.
Okay, so I always tell people कि आपके जो vendors थे, पहले भी थे, आपके gala stores थे, आपके vegetable vendors थे, talk to them. They might actually give you more information, and if you trust them, you will get all the good stuff at a lower rate also. So that is another thing. So I think my biggest myth is that lifestyle is very expensive. अगर आपको healthy होना है तो बहुत पैसा होना चाहिए. A normal, even if a worker in a store, like a jewelry store or something cannot be healthy. Or I talk to a lot of maids, the school वगैरह में जो होते हैं, I talk to a lot of employees and all also. So everybody can be healthy. You don't have to eat a blueberry. Okay, blueberry is expensive. Okay, don't have it. But you can have a banana, you can have an apple. That's pretty affordable by most of the country.
Is blueberry actually far more nutritious when it comes to banana, when it is compared to banana or an apple?
No. So why is blueberry so famous? Because it has antioxidant property. Mango also has an antioxidant property. No one will have mango. Why? Because mango se sugar बढ़ता है. So these are so many myths are there. So that's another myth, right? If you're a diabetic, I cannot have fruits. No, you can have a fruit. The only thing is don't have anybody, not diabetes related, but don't mix fruit with your cooked meals. I know people के जैसे अगर बारिश हो गई तो exercise नहीं करेंगे. Why? Because अभी कहाँ जाए walk करने के लिए. So if you depend on the external environment, you will go down the drain. So instead you have to understand कि हाँ अगर बारिश होने वाली है, so I will learn to do something within the house. I tell people, if you keep your health in the center, especially women, वो बोलते हैं ना, एयर होस्टेस बोलते हैं कि पहले मास्क अपने आप को पहनाओ और फिर किसी को हेल्प करो. I think that's very true even from a health scenario. Like whatever you are doing, help yourself.
Help yourself first before tending to others.
Exactly, because then you will be more efficient also to help others. That's the whole point. No one is saying be selfish, but self-love is important.
Yeah. So I just have one last question, Dr. Akshat. You are in medical field. You are talking about wholesome health. Are there any specific medical advancements or technological advancements that you are excited about, which you would like to share with us as to how, the holistic health industry is, in what direction is it moving towards?
So are you asking conventional medicine, or you're talking about the
overall trajectory of where the healthcare is headed?
No, so I think the good part is now we are moving towards preventive healthcare. We are moving from sick care. So there is a spectrum, right? One is sickness, sick care, and the other is wellness. You have to choose these advancements. You have to choose your doctors, your nutritionists. Now, again, from a nutritional perspective, also, I get very worked up because a lot of people diet plan लेके आते हैं या nutritionist से consult करके मेरे पास आते हैं, and they are so overwhelmed कि हमने कुछ किया, हमने 6 किलो वजन कम किया, but जैसे ही हमने ये बंद किया, ये डाइट प्लान बंद किया, हमने 10 किलो वजन और पुट ऑन कर लिया. So it is, again, you got to choose who you go to, and the easiest way to choose is sustainability.
Right.
अगर आप, you have to ask yourself this question: can I do this for the rest of my life?
Okay.
Can I do this? Then do it. If you can't do it, then go back to your expert and discuss कि अच्छा what else can I do? और suppose superfoods दिए हैं, supplements दिए हैं, ठीक है, वो life के लिए नहीं होते हैं, but ये कितने दिन लेना है, ये 2 महीने लेना है, इसका क्या असर होएगा? You are allowed to ask your questions.
True. So how to go about finding the right person, whether you want to go to a nutritionist or you want to go to a doctor, or whether you want to go to somebody who is, say, for mental health, is a life coach or a mindset coach. Because there are so many options available, how does one go about structuring what kind of care and help they need to have that perfect body-mind balance?
What they need at the end of the day, what are you trying to achieve? What is your goal at the end of the day? अगर आपको obviously disease manage करनी है, you should have a medical health expert with you. You cannot only, I always tell, if you're on medications, don't do only nutrition. That's not right. Health is a risky kind of a, area. It's a gray area. That's why everybody is allowed to talk about health. Everybody. जिसको health के बारे में बात करना कर सकते हैं, because it's a gray area. But at the end of the day, as a patient, you have to safeguard yourself. I think that's most important.
Yeah. That's very insightful, Dr. Akshat. I think you answered a lot of very prevalent and very prominent questions, which most of us have. We spoke about gut health. We spoke about mind-body connection. We spoke about how to have a wholesome lifestyle by discussing the 6 pillars of health. That, for me, itself has been very profound. I mean, I did not have knowledge of that. So thank you so much for that. For all the audience listening to this podcast, I hope you thoroughly enjoyed it. You got a lot of knowledge out of Dr. Akshat. If you have any questions, Please feel free to connect with me, send those questions to me. I will try to share them with Dr. Akshat and get those answers for you. Meanwhile, please do share this podcast with your friends and family, because health, nutrition, as Dr. Akshat said, is a gray area. So it's better that we equip ourselves with the right knowledge, right tools. Anything you would like to add, Dr. Akshat, before we sign off?
I think this is very good. That's a perfect sign off. Okay. Thank you so much for having me, honestly.